Hi, I'm Vicki Russell Walton, and I'm the Cancer Prevention Specialist at the African American Health Program. Today, I have a special guest with me, and we're going to have this conversation on the Pink Couch. Of course, it's called the Pink Couch Conversation. So today, Wanda and I, we're going to talk about cancer journeys, and what we would love to see in the future. Wanda Smith.
Hey.
Thank you so much for agreeing to be here with me today. How are you?
I'm doing good. Thank you for inviting me. I appreciate this.
Tell us who you are and what you do.
My name is Wanda Smith, and I am a social worker with the African American Health Program. And so I provide therapeutic support, mental health activities, and therapeutic groups for African Americans in Montgomery County.
Awesome. I know it was important for me to have you here because dealing with cancer goes along with mental health. What does that have to do with mental health? We go through so much. As a two-time breast cancer survivor, I did not understand the medications even made me go into depression and gave me horrific dreams. All of that falls under mental health, and it was such a challenge dealing with it because my doctor never told me those were side effects. She just kept asking me if I was happy. But then when you and I had a discussion about it, you're a survivor too.
Absolutely.
Tell me about that, your journey.
I am a 13-year survivor of breast cancer. So in 2013, I woke up one morning and had blood all over my pillows and sheets. I didn't know what was going on. I have allergies and all, so I thought, okay, my nose was bleeding during the night, and I didn't think anything of it. And then the next morning when I woke up, it was even more blood. It was all down my pajamas and all over the sheets. And so when I took off my clothes and examined myself, I had blood coming from my left nipple. So I went to my primary care physician, and she was perplexed about it. I had a mammogram probably about 6 months before that. Mammogram was normal. So my doctor recommended that I go see a breast surgeon. So she recommended someone for me, but that person was no longer around. So I went to the Georgetown site, and they have a Brady Orsman Breast Center. And so I called them up, and they scheduled an appointment for me right away. I went into the breast cancer center, and when I went back for the examination, I met with the physician's assistant. And she said, first of all, I want to assure you that you don't have breast cancer. What you have is mastitis, which is inflammation and infection of the milk duct. But we're going to do another mammogram on you and another MRI on you to make sure that it's not cancer, which they did. MRI did not indicate anything. The sonogram did not indicate anything. They couldn't find anything. So I'm feeling good. I'm thinking, okay, this is mastitis. But the doctor that I had said, I'm going to give you an MRI to rule out breast cancer. And so next week I had the MRI, and on the day after Christmas, they told me that I had breast cancer. I had 0-stage breast cancer.
Thank God.
Yeah, but still, you gotta go through the treatments and stuff. So you have the option of do you want to keep your breasts? Do you want to do a double mastectomy, a mastectomy,
Huge
or what
decision.
we can do is a partial mastectomy. But she did tell me that the good thing of it is that it would not affect my mortality, but I still had to do all the work, the surgery and everything. And I also had to have the radiation therapy and medication therapy. So I had the partial mastectomy.
Double.
Yeah.
Yeah. So I
can't.
know I'm right there with
Yeah.
you, sis. But in all of that, I'm so proud of you for advocating for Wanda. And not just saying, okay, she says it's gone, no big deal. You have to really get out there and advocate. And it's important that you advocate for yourself because you know your body. Mm-hmm. So if something doesn't feel right, you have the right to say, look, doc, I need you to check it again and check it again. I want you to tell them how important it is to seek help mentally when dealing with cancer.
Well, it is very difficult mentally because you don't want to think that you have it. I don't have a history of breast cancer in my family. And so it was hard for me to believe that that I had it.
Yeah.
I think I'm a fairly healthy person. I exercise, I eat pretty healthy. So where did it come from? So that was swirling in my mind. Wow, where did I get it from?
Where did it come from and will it come back?
Yeah.
My God, we're always thinking, is it back? Is it back? Is it back?
And we think the doctor is God too.
Yeah.
Because what they say we need to believe in, even though we may be feeling certain ways. Absolutely.
They are the authority.
We may be feeling certain ways, but we trust them and we think they're authority even over what we may be feeling.
And there's nothing wrong with crying. I tell people that all the time. If you need to cry, cry. If you need to scream, scream. If you need to go out and dance in the rain, go dance in the rain. Because what you're trying to do is find your new normal. The old normal is gone. We're not going back there, but the new normal, I love to go outside and put my feet in the grass. For some reason, it grounds me and it helps me. But I also know that in our community, there's a taboo with us talking to people about how we feel. And I don't think that should be so. Because we could end up talking to you. And I think you're one of the coolest ladies I know. So it's easy to talk to you. However, I have sisters that I can't talk to because when they see me cry, they can't handle it. So instead of me pumping me up, I have to end up patting them. It's okay, come on. It's like, no, I need to cry. I need to scream, but I can't do it with everybody. So having you is a big difference. It makes a world.
Well, you know, when I was diagnosed, I didn't tell a lot of people. A lot of people did not know that I had breast cancer. No, I didn't tell a lot of people that I had it because people tend to think they treat you differently.
They do. Poor pitiful.
And then when people found out that I had it, if they knew of somebody that had cancer, they would immediately bring them to me. This
and they're
person
all
has
dead.
cancer.
And they're all dead. Like, mine was, my aunt had cancer. How's she doing? Oh, she dead.
Yeah.
My grandmama had cancer. Well, how's she doing? Oh, she died. It's like, do you have anybody in your family you want to share with me that's alive? Because we don't share the positive.
Right.
We share the gloom, doom, and the poise me, but we don't share the positive.
Yeah.
And that's why I love that the fact that we have a cancer department at the African American Health Program that can help. We have a mental health department at the African American Health Program that can help. And if they reach out to us, we have a support group. You also have your 2 support groups. So they have resources in just not Montgomery County, but in Montgomery County, there's lots of resources for those going through.
Right. And you know what I found was interesting is that when I was, every time I would go into the doctor's office for a visit, a social worker would always come, and I was like, oh, here come the social worker. But she asked me, do you have food? Are your children, and do you have children who need a daycare or some type of service to keep them while you're in treatment? Are you able to pay your rent? Are you able to, do you have transportation?
Yep.
And I realized that when women have those kind of issues, that it really affects their ability to heal. If I'm going to be in treatment, how am I going to pay my rent? How am I going to go to work and pay my rent? What's going to happen to my kids? Are they, who's going to keep them while I'm in the hospital for several days? How am I going to pay for my medication?
Wow.
So just the daily needs of an individual can affect their mental health.
Right, but that's why they need us.
Right.
They don't, I always say, you heard me say this a million times, they don't know they need us,
Right.
but they need us.
Absolutely.
And when they do need us, we're right here waiting for them.
And absolutely, insurance. If
Yeah.
you don't have good insurance, you're not going to get a great level of care.
Yeah.
They're not going to send you to the specialist. They're not going to make sure that you've had physical therapy or all these things that you need to get healthy. And so you have to, and oftentimes, if you're going to a free clinic, they may not diagnose you, or you may not. Yeah.
So they need to have a conversation with you, and they need to have a conversation with me. And I can't believe we're almost out of time. Tell the people one thing you want them to know. Anything you want them to know.
I want people to know that you need to do daily or regular breast checks. Mm-hmm. If you find the inkling of something irregular with your breasts, you need to go to the doctor immediately. Yeah. If you are scared, talk to someone so they can accompany you.
Good stuff.
And just, find a support system.
That's
someone
great.
that can help you through it.
That's great. And I want to leave you with, this journey. If you don't ask for help, we won't know to help you.
Absolutely.
We can't read their minds, and Superman is not coming to save you. You've got to save yourself, but when you're too weak, we're there to pick you up.
Absolutely.
So I thank you so much for coming.
Yes.
That was some good stuff. Thank you. From one survivor to another. I am Vicki Russell Walton with the African American Health Program. You can reach us at 240-777-1833. We're more than happy to assist you in your fight against cancer, but also dealing with mental health and other issues. We look forward to having a conversation, so reach out to us when you can. Have a great day, and we hope to see you at the Park Goes Pink October 18th.
Yes.